CPC Certification Quiz Real Exam Style Questions AAPC 2026. Question 1. Which of the following conditions would be considered to be volvulus? Option A. Infection of one of the cardiac valves. Option B. Obstruction of the intestine due to an overgrowth of valvular tissue. Option C. An inflammation of the external genital organs of a female. Option D. Strangulation of the intestine. The correct answer is option D. Strangulation of the intestine. D. Strangulation of the intestine. Question 2. Dysphagia is: Option A. Abnormal cell growth. Option B. Speech disturbance. Option C. Difficulty swallowing. Option D. Shortness of breath. The correct answer is option C. Difficulty swallowing. C. Difficulty swallowing. Question 3. Which of the following lists only components of the digestive system? Option A. Mouth, large intestine, liver, spleen. Option B. Trachea, stomach, large intestine, anus. Option C. Mouth, stomach, pancreas, colon. Option D. Stomach, liver, colon, spleen. The correct answer is option C. Mouth, stomach, pancreas, colon. C. Mouth, stomach, pancreas, colon. Question 4. Which of the following is not part of the endocrine system? Option A. Pituitary. Option B. Pancreas. Option C. Ovaries. Option D. Lymph nodes. The correct answer is option D. Lymph nodes. D. Lymph nodes. Question 5. What does the term acromegaly mean? Option A. Fear of heights. Option B. Enlarged kidneys. Option C. Enlarged extremities. Option D. Fear of falling. The correct answer is option C. Enlarged extremities. C. Enlarged extremities. Question 6. What is another term for the bicuspid valve in the heart? Option A. Mitral valve. Option B. Tricuspid valve. Option C. Pulmonary valve. Option D. Aortic valve. The correct answer is option A. Mitral valve. A. Mitral valve. Question 7. Which of the following types of diagnosis codes should never be reported as the first listed diagnosis code? Option A. V codes. Option B. Codes printed in italics in the tabular list. Option C. Poisoning codes. Option D. Codes for signs or symptoms. The correct answer is option B. Codes printed in italics in the tabular list. B. Codes printed in italics in the tabular list. Question 8. Jimmy fell off his bicycle, leisure, and was taken to a local hospital's emergency department. The emergency physician did an expanded problem-focused history, an expanded problem-focused exam, and performed medical decision-making of moderate complexity. The exam reveals a 3 cm laceration to Jimmy's forehead and a large contusion to his right knee. The knee X-rays were negative. The physician did a simple repair of the laceration. Select the appropriate diagnosis codes for this encounter. Option A. 873.42, 924.11, E826.1, E006.4, E000.8. Option B. 873.42, 924.11, E885.2, E006.4, E000.8. Option C. 873.52, 924.11. Option D. 873.42, 924.10, E826.1, E006.4, E000.8. The correct answer is option A. 873.42, 924.11, E826.1, E006.4, E000.8. A. 873.42, 924.11, E826.1, E006.4, E000.8. Question 9. Susie presented to the emergency department vomiting blood. The emergency physician determined that the vomiting was due to esophageal varices resulting from liver cirrhosis. Select the appropriate diagnosis codes for this encounter. Option A 456.0, 571.5. Option B 456.20, 571.5. Option C 571.2, 456.21. Option D 571.5, 456.20. The correct answer is option D, 571.5, 456.20. D 571.5, 456.20. Question 10. Mr. Morgan reports to his physician feeling very dizzy. It is discovered that his blood pressure is elevated, 210/190. The physician documents a diagnosis of end-stage renal failure due to malignant hypertension. Select the appropriate diagnosis code, S, for this encounter. Option A, 403.01. Option B, 403.01, 585.9. Option C, 403.01, 585.6. Option D, 404.02, 585.6. The correct answer is option C, 403.01, 585.6. C, 403.01, 585.6. Question 11. Mr. Barber reported to his primary care physician complaining of difficulty breathing. He is HIV positive, but prior to today has never had any symptoms of HIV disease. The physician examined Mr. Barber and documented that his breathing difficulty was due to pneumocystis carinii pneumonia, PCP, a HIV-related disease. Select the appropriate diagnosis code, S, for this encounter. Option A, 136.3, V08. Option B, 042, 136.3. Option C, 042, 480.8, 079.89. Option D, 136.3, 042. The correct answer is option B, 042, 136.3. B, 042, 136.3. Question 12. Mr. Sawyer was adding water to his car battery when the battery exploded. He reported to the local burn center that tracks the mortality of burns. After examining Mr. Sawyer, the emergency physician documented a diagnosis of third-degree burns to the right palm and a second-degree burn to his left cheek and forehead. The physician determined that the burns were caused by contact with the battery acid. Total body surface burned was documented as less than 10%. Select the appropriate diagnosis codes for this encounter. Option A, 944.35, 941.20, 948.00, E924.1. Option B, 944.30, 941.24, 948.00, E923.2. Option C, 944.35, 941.27, 948.10, E924.1. Option D, 944.35, 941.27, 948.00, E924.1. The correct answer is option D, 944.35, 941.27, 948.00, E924.1. D, 944.35, 941.27, 948.00, E924.1. Question 13. Carrie reported to her physician with an acute sore throat. The physician diagnosed this as strep throat and gave her prescription for ampicillin. After taking 2 doses as prescribed, Carrie developed a skin rash. She returned to the physician, who determined that she was experiencing dermatitis as a reaction to the ampicillin. The physician discontinued the ampicillin and called in a prescription for another antibiotic. Select the correct diagnosis codes for this encounter. Option A, 960.0, 693.0, E930.0, 034.0. Option B 693.0, E856, 034.0. Option C 693.0, E930.0, 034.0. Option D 692.3, E930.0, 034.0. The correct answer is option C, 693.0, E930.0, 034.0. C 693.0, E930.0, 034.0.